Can we get started? Good morning, class. Good morning, good morning, good morning. Okay, and I think I told you last time that I'm a political scientist, so this is my favorite session on politics and on thinking about, if you do all the things that you've been thinking about during this week so far, how you can try to turn it into some decisions that are made and then can be implemented, right? So thinking about it so it's not just about the technical issues that we've been spending most of the time this week, but also thinking about the political process and how you can take advantage of it. I'm going to shorten this session and skip over some of the slides that are my favorite part because they're about how you think about politics, to focus on the stakeholder analysis and to give you a chance to apply it in the last half hour of this session. So you'll have an exercise to try out some of these things. But I first want to ask you, what do you think of when you think of politics? What is it? Why would we have a session on politics? What do you think of? What are the words that come to mind? What do you think of when you think about politics? Yeah. Oh, worry, right? What do you think about politics? Or politicians? Are they good people? Do they listen to you? Sometimes yes, sometimes no. Well, let me tell you what we usually, as political scientists, we talk about politics as something that tells you who gets what, when, and how. So it focuses on how decisions are made about what you're going to do, what kind of policies you're going to do, who's going to receive the benefits of those policies, right? And when they're going to get it. Right? And I like to elaborate that a bit by saying that it's about how public people make decisions or organizations make those decisions about health resources and the policies that you use to do those things, and how they are implemented as well, right? And often we think of politics as happening only at the national level, right? We think, okay, it's something that happens in Parliament or in Congress, it's something that the President or the Prime Minister makes decisions about, but politics happens at all levels, right? Because if you have a decentralized system, then a lot of the decisions will be made at the governor level or the mayor or the assembly at the local level. And even internationally, the jockeying about universal coverage between the World Bank and WHO, some of the decisions that are made with the other donors as well, all involve these kinds of decisions about how you use health resources, how you're going to implement them, right? And what you may know more about are the internal politics of your own bureaucracy, right? I work at Harvard. If I want to hire a certain kind of new faculty member, I can't make that decision alone. I have to think about who do I have to work with on the other members of the faculty and how to try to get a decision that we can all live with, right? So these are, and I think you all know probably more about the kind of politics that goes on within the Ministry of Health or within the NGO that you're working with or within the provincial government. Those are things that you have to pay attention to. One of the problems that I see, and it may not be a problem here, is that many people see themselves as making technical decisions if they're involved in public health. And a lot of the training that you're getting in this course is about how to make a good technical decision. Right? And if you think about politics, you often think that politics is what gets in the way of doing the things that you know are best. Right? Does that sound reasonable to you? However, if this was a room full of experts on education, you would have a different set of technical things that you think ought to be done, and you would think that you shouldn't be spending so much on health because education is more important. And so the important thing to think about politics is that it's usually about compromise among different interests, and that if you just make your technical arguments and you don't think about how to persuade other people to agree with you, then you are not going to get what you want, and they will get what they want. Right? So what we'll try to do in this session is talk about the rationalities of politics and how you are competing with other interests and what you can try to do. Or if you're not doing it, advise the minister or others who are involved in making the negotiations about what policies need to be done and how to think about it. If you don't do that, all you do is prepare a plan that's not going to be adopted and is not going to be implemented. Right? So this session is to try to help you think about how things happen. Now, there are a bunch of tools for political analysis that we could go through. And I'm going to introduce them to you now, and we can spend a little more time if we have time at the end of the session. But the first one is thinking about when decisions are made, and this is something we call the policy process sequences. And then how decisions are made, and that is the decision-making models, thinking about the best ways decisions can be made. And then who makes decisions, and that's what I want to focus on in the stakeholder analysis and the exercise that you can do in the last half hour of this session. Okay? Does that make sense? Yes, teacher? Yes, teacher? Okay. So, and one of the things I'd like to do is for you to think about some of the examples of what you might want to do using this kind of analysis. And one of them will be, think about what you might have to do to replace donor funding with national funding during the transition for the kinds of TB and HIV/AIDS and immunization programs that we've been talking about in this course. Right? So here's a brief introduction to the issues of when decisions are made, and it's the policy process cycle. Right? It starts with signaling, which puts onto the agenda a decision that needs to be made. Right? It can be that there's an HIV/AIDS epidemic going on, or that there's TB happening, or that there's a lot of out-of-pocket payments, and it says, we need to make a decision about this. Right? Then the second part of the sequence is the consultation and formulation of what kinds of options could be done to address that problem. Now, we do this in this flagship course. We talk about the objectives and the ultimate objectives and the things that are the problem, and then we talk about the different control knobs that you could do in the consultation and formulation stage. And then we move to something that people think about as politics, and that is aggregation or building support for the proposal, the technical proposal that you think is the best. Right? Building support, and then ratification is where the decision is made. So if it's something that needs a law, then you need to go to Parliament or Congress and make a new law, and so that's going to affect what you need to do in the aggregation stage. Right? Where do you have to go to build support for your proposal? Right? And so the ratification is the arena in which the decision has to be made. Now, it used to be that we thought politics ended there. When you pass a law or you make a regulation or you make a change in the policy of the Ministry of Health, those things happen, and we used to think that that was the main part of politics, right? But now we know that a lot of politics continues in implementation stage, right? Once you've decided that you should do something and you have the plan, the losers are going to continue to fight against it, and you're going to have a lot of problems that are difficult to implement and involve different stakeholders, right? So implementation, you need to also think about politics. If you've all heard at all about Obamacare in the United States, Obamacare was our major health reform under the Obama administration. Right? We passed that law 6 or 7 years ago. The Republicans have been angry about that ever since it started, and they continue to try to stop it and to do things that will undermine its implementation. So in terms of sustainability of the things that you might want to do, you need to also think about what happens after the law passes and what can I do to try to make sure that the things that we think will work will continue. And then we want to evaluate and feedback and see whether the things that we designed in the formulation and consultation stage actually have achieved the objectives that we had in the signaling period. Does that make sense? So this means that you need to think about the politics, and they may be different in those different stages. Okay? Okay, I'm going to skip over a bunch of slides here that go through in a little more detail those things. The second tool to think about is how decisions are made. And a political scientist at Harvard came up with an analysis of how to analyze a major decision, looking at how different ways of explaining that decision could be. And it was the decisions that were made during the Cuban Missile Crisis in the 1960s, right? When Kennedy and Khrushchev were making decisions about whether we would go to nuclear war or not. So it was an important set of decisions, and a lot of different analysts looked at how those decisions were made. And Graham Allison came up with 3 different ways decisions could be explained. Rational actor model, organizational process model, and then something he called bureaucratic politics. But because organization and bureaucracy sound similar, I like to call it the bargaining model. And I'm going to quickly go through some of the assumptions about each of those models to give you a sense of what would be, how you could use it to analyze how decisions are made here, right? Rational actor model assumes that there's one decision maker. They may have advisors, they may have other people helping them, but there's a single actor, and that actor tries to establish what he wants to achieve, what goals and objectives he has, and puts them in a priority order, and then carefully goes through and thinks about all the options that could achieve those goals. And in this model, the choice is made by what we call value maximizing decisions, right? You choose the best option that achieves most of your goals. Right? In the Cuban Missile Crisis, Kennedy wanted to get the missiles out of Cuba, but he wanted to avoid nuclear war. Right? So he had to then think about, what are the options? Should I invade Cuba? Should I bomb Cuba? Should I put a blockade around Cuba? Which one of those options will work the best? And he chose the blockade because it would achieve his goals the best way, right? And this is a model that I think we assume when we talk about doing things in the flagship course. We set out our objectives, our goals, and we think about what are the different options from international experience or from your own experience. What can you do to try to get the best solution? This is what we would like decisions to be made. That's the way we'd like to make it. Now, Graham Allison says, yes, that's a good model. We would like to do that. But a lot of our models, a lot of decisions don't happen that way. Right? And one of the other alternatives is that organizations make the decisions, or people within organizations thinking about the objectives of the organizations themselves will want to make those decisions. Right? And they choose their goals because of what the organization needs, not necessarily to solve the bigger problem. Right? And instead of going through and thinking about what are the best options that would make for what we call the value maximizing solution, we do something called satisficing. We choose the easiest solution that sounds like it's going to work. Now, this is because people in organizations usually don't have much time to carefully think through what are all the different kinds of options. Nor do they have the resources to do the research to find out. Right? So they do something that the analysts that use this called satisficing. Rather than value maximizing, they choose the first good idea that sounds like it might work. And organizations also work by standard operating procedures. In fact, that's why we have organizations. Right? We have routines that have been worked out, and people learn, and they do things the same way, and it's hard for them to change and do something different. But that's the reason we have organizations. If you have a heart attack, you don't want to go into the surgery theater and have the nurses and doctors stand around and say, what are we going to do today? Right? We want them to all know their routines and what they should do and how they should behave. Right? So that's part of what an organization does, and it means then that the decisions are likely to be things that have been turned into routines. Right? And that leads to incremental decision making rather than decisions that are necessarily quick and responsive or the best value maximizing kind of solutions. That's the second model that he explained. The third model is what I call the bargaining model, and that is decisions aren't made by a single actor. They're made by negotiations and pulling and hauling and different interests deciding what would be best for them. And so the solution becomes a compromise among the different interests. And so it may not be the best solution, the best technical solution, but it will be the one that emerges out of the political process of bargaining and negotiating. Right? To use the Obamacare example again, Obama explicitly said after he got the law through, he said, this isn't the best reform. This isn't what I really would have wanted if I could make the decision. But in going through the congressional process, we had to negotiate and compromise and figure out what all the different interests could achieve together and agree on. Right? And so it's not the value maximizing solution of the rational actor, and it's not the satisficing solution of an organization. It's the compromise among the different interests, and it's the best compromise that can be achieved, right? Okay. And one of the things about this model is where you stand depends on where you sit. Right? Your position will depend on your own interests, and that will explain why someone who is in the Ministry of Health wants to do things that are for the objectives of the Ministry of Health, but someone that is working in the Physicians Association will be working for what is best in the interests of physicians. Right? So this is the way of thinking about a lot of the political process. Right? Okay. Does that make sense? Okay. Now, what I tried to do with this matrix is to combine those two different ways of thinking about politics. Right? These over the top here are the policy cycle from I guess that's signaling to evaluation, right? And here are the three different ways of thinking about how decisions are made. And what I've done is tried to put an X in the box that tends to be, in my experience, where a lot of the decisions are made, or how a lot of the decisions are made. In signaling, we often use the rational model, right? It's the thing, and we often, as public health people at least, get involved in making, in promoting and saying, we have an out-of-pocket payment problem here in this country, right? We need to do it. We are able to show it with evidence, and it's a rational argument to make. And then maybe in the consultation and formulation stage, we will also be doing what we're doing in the flagship course. Let's think about what the alternatives are, what the best alternative could be. But then, in the aggregation stage, that's when we start bargaining and negotiating and compromising, trying to find what would be the best solution, and that ends up with some decision made in an arena like Congress or the office of the minister, or some way of making the decision become official. Then in the implementation stage, that's when the organizations that have to implement it, they become a more dominant way the decisions are made. Slow process, incremental, changing some of the standard operating procedures, satisficing rather than maximizing. And then in the evaluation stage, we may try to go back and to use the rational actor model, the one that would be the best way of evaluating it. I put a question mark here because I've been involved in some evaluations of USAID projects and World Bank projects. And I try to use the rational actor model when I evaluate any program. But I'm often hired by a consulting company. And the consulting company will tell me, go to the USAID officials that are hiring us and find out whether they like the project or not. Right? Because we want you to give them what they want. Because then we can get another contract. Right? That's an example of organizational process, where the objectives of the organization were more important than the objective of the policy problem that you're trying to solve. Right? Of course, I didn't do it that way. Right? I'm a rational actor. Right? Okay, so now I want to spend more time on what you might think of as the bargaining model in more detail. And it's something we call stakeholder analysis. Have any of you done any stakeholder analysis? Do you know what it is already? No? Yes? What did you do? Where are the... Oh, there's one.
During the stakeholder analysis, we look at the identification of weaknesses and strengths, because on the one hand we can identify the list of all stakeholders who will agree with our approach for introducing any strategic project, will provide, who are like the positive stakeholders, and and also the negative or those who disagree. And in the middle, I think we can put the floating stakeholders, maybe, if I'm not mistaken, who are not decided yet whether it's a positive or a negative. And secondly, we take the steps for positive stakeholders, how they can support us in implementing the project. And for the negative or those who resist or are in the opposition, what type of problems they can cause and what steps can be taken to overcome those. And for the floating stakeholders, what steps should be taken so that they also support the ideas and share the same things, so same goals.
Right. You've already done this. Has anyone else done a stakeholder analysis? Yes? What subject did you do? What kind of program did you want to?
I was studying PMP, and in this course we've done the stakeholder analysis. I would like to add that it's very important to find your stakeholders, because sometimes there are hidden stakeholders that you don't pay attention, and then they are becoming very difficult group of people to deal with.
Very good, very good. Okay. So that's an important lesson in general, is to be sure that if you're doing an analysis of the stakeholders, you try to make the list as long as you can. Make sure that you know as many as you identify as many as possible, right? Anyone else?
In our work, we are implementing different projects for the financial sector development, and we also use the stakeholder management, and we use the metrics of stakeholders, and depending on the power of the current stakeholder, we treat them differently. So keeping informed or to considering their opinion, and etc., etc. Yeah, we are treating stakeholders depending on their power.
Okay, very good. So that's not only then, the issue of the stakeholders is not only making sure that you have the full list of all of them, and as you pointed out, you want to know whether they're in favor of what you want to do or opposed to what you want to do, and whether they're neutral, but then you also have to think about their power. How much power they have, because those who are more powerful are going to have more of an influence on the decisions. Now, it's important when you think about that is to realize that the most powerful people in the country may not be interested in your problem, right? So you need to focus on the stakeholders that are important for making the decisions that you're involved in. So if the president may not be too concerned about this, the president may be very powerful, or the governor, but it may be that you need to work only with the Ministry of Health people or the people in the Parliament that are less powerful in a general sense, right? Good. Anyone else? Okay, for those who haven't worked on it, let me go through a quick detail of what stakeholder analysis is like, right? It focuses on who are the major actors, and that they can be individuals or interest groups or broad social groups, right? You could be thinking about the minister or the president or any expert on public health that might be important. It might also be the Association of Physicians or a union group or businesses that are interested in having insurance, that sort of thing. And it could also be the broad social groups that support or don't support the general objectives that you have. It could be women, it could be the poor, it could be other broad social groups, especially if you're in an electoral process where they may be important actors that the other actors will be paying attention to. And one of the things that's important is the actors may have different positions or they will be in favor or opposed to what you want to do depending on the goals and the means to reaching those goals. Right? So you may want to think, do the stakeholders agree with the problem I'm trying to solve and just disagree about the means or the way I want to do that? Or do they oppose the goal that I have? Are they in favor of something completely different? All right? And then they will have different degrees of power, as we've talked about. Now, one of the tools for doing this kind of analysis is one of my colleagues came up with a software package that forces you to think through the whole set of different actors, what position they would have, and what level of power they would have. And it's called Policymaker, and I'll give you access to that to a link at the end of this session. But here is one of the panels in his software, and let me quickly try to go through this and show you what it shows you. Right? This is from high support to high opposition, and the example that's being used here was the Clinton plan, the earlier health reform that failed in the United States, right? And so here we have the high supporters, which was Bill and Hillary Clinton and their major advisor. We have a lot of opponents from the Republicans and from the insurance companies and from a variety of different associations. But we also have medium interests, medium support and medium opposition. And then there's a large group, as you identified here, of people that are kind of floating. They don't know whether they're in favor or opposed to what you want to do. That's the press and the Department of Labor, the insured and the uninsured. These are different groups. Now, in this model, the black is high power, the gray is medium, and the white is low power. Right? Now, what's interesting about this is, first, it forces you to say who are the major actors, and it then says, are they in favor and how much are they in favor of what I want to do? Who is opposed and how powerful are they? And who might be changed if I persuade them because they don't have a position right now? Right? Who is in the middle, neutral, non-mobilized is what we call it. Right? Now, we won't be able to do this in an exercise today, but one of the interesting things in this software is that there's an algorithm for combining the different positions and the different powers so that you can add it up and see how much power, how much support you have, how much opposition, and how big the group that hasn't decided yet is. Right? So this was a map of the Clinton plan before he tried to do anything to change people's positions. Right? So it shows that the Clinton plan, at least, had a lot of opposition. Right? And there are a significant number of supporters. Now, if you saw that, what would you do? If you see this as the position map of stakeholders once you've decided what you want to do, but before you've developed any strategy for changing people's positions or power, what would you do if you saw that? Would you give up? No. So what would you do?
Sometimes the floating part, in many cases, is the bigger. But in this case, the opposition is very high.
Yeah.
But sometimes very strong opposition gets into the green area more like
What happened? What happened? Try again.
Sometimes the people who have strong opposition,
Yeah.
if you convince them, then they are very active. your partners, not opposition, becoming your partners. So sometimes it's more difficult to convince this floating part that.
What's the other? Yes, this isn't working. Yeah, good. Okay. So what it tells you is this is your starting point, right? And then the next step you want to do is to think about what strategy you could do to change the positions, right? You can give up, right? You could say, okay, it's impossible. It's there's too much opposition. I can't make a difference. In the United States, for a long time, we thought that trying to have a single payer plan would look like this, right? That it wouldn't be possible to make that change. And over time, people have tried to open it up and to make more of a possible change, but the Obamacare plan realized that they couldn't try to do that. Political situations change, so you may be able to do that. But one thing happened with that was that we decided we can't do that. We saw something like this, there's nothing we can do. But you can then develop other strategies for trying to achieve what you would like to achieve. And you're working on a series of reforms that we've been talking about this week. You could choose some of them to develop the strategies. Now let's talk about some of the ways of thinking about this. The first thing is to look at what you need to know about why someone is in favor or opposed to what you want to do. The first thing to do with the stakeholders is say, do they agree with my goals? Right? And then are they only opposed to the mechanisms that I'm going to use? Do they agree that we need to do something about TB and HIV/AIDS, or do we need to do something about out-of-pocket payments, right? And then, if they agree with us, it's usually much easier for us to try to persuade them that the mechanisms that we're proposing are more likely to achieve that goal than other mechanisms, right? So you would look at then some of the options that we're talking about here and try to use the evidence that we have in a rational actor kind of way to persuade them that you can reach your goals better by doing it this way, the way you want to do it. Now, the other thing to recognize is that actors' positions are not always obvious. I was doing a World Bank project in Costa Rica, and we were proposing to do something that looked like it was privatizing. It was to create cooperatives of doctors that would be in the private sector, and we would use public money to pay them for services. Now, in Costa Rica, the system had been one in which there was a large public entity that was both the insurer and the provider of services, called the Social Security Institute, and it had union members that were very supportive of that institution. People told me that the union would oppose our proposal and they'd go out on strike, and there would be a huge political problem, and therefore we shouldn't propose privatizing in this way. Well, I wasn't sure that was true, so I went down and talked to the union people. Everyone thought they knew what the stakeholder was going to do. Right? I talked to the union people, and they said to me, well, you know, we go out on strike when someone has been fired unjustly, or when we need to have higher salaries. Right? That's our usual reason for opposing something that the government is doing. But we usually don't get involved in these kinds of policy decisions. He said, and also, you know what happens with our workers? They work in the public sector in the morning, but guess where they work in the afternoon? They work in the private sector. Right? And they may see this as a new opportunity. So we may not be able to even mobilize them for a strike. Right? So I went back to the World Bank group and I said, we should try this. And we put it in place and they didn't go on strike. So it's really, the lesson here is, don't just assume that you know where the stakeholders are until you've done some research to try to find out. Now, sometimes you won't be able to change their positions. If you have a family planning project, you're not likely to get the Catholic Church to support abortions. Right? So you may have to compromise if you don't want the church to be completely opposed to what you want to do and take out some of the things that that you can't change, right? Other positions may change if you change the details of the mechanism that you want to use, right? And then the positions may change in the process of implementation. Medicare and Medicaid in the United States were strongly opposed by the American Medical Association, the physicians, right? They really thought that this was an invasion of their choices and their own ability to make decisions about health care. They thought the government was going to dictate what they had to do, and they were very opposed to it. More recently, when there's been a threat by the Republicans against Medicare and Medicaid, the American Medical Association is one of the most fierce defenders of Medicare and Medicaid, our social insurance systems, right? Partly because doctors' salaries significantly increased during the period of Medicare and Medicaid, and their interests were much better served, right? And so they changed their position in the implementation, and they saw what was to their advantage by having this kind of a program. So again, positions are things that you can think about, you have to think about, you have to research to find out what the different actors are going to choose, and they may change over time. Now, power is another problem for us. They call me a political scientist, but power is probably the least scientific thing that we can analyze, because it's about relationships between different actors and who will listen to you, who will pay attention to you, right? And it depends on a lot of different things. It depends on the resources that each actor has. It depends on the institutional structures that empower different groups. Unions in some countries have more power than they do in more authoritarian countries where unions don't have much of a role, right? Then political situations change, priorities, and what people really want to do. If they're focused on education reform, they're not likely to focus on a health reform, and so no matter how much power you have in the health sector, you may not be able to do much in that situation. And then implementation may change the positions and power and the power of different groups, right? So, but we can do some ways of estimating power, right? And often looking at how much money a political actor has, or whether they're able to mobilize voters if it's a democratic system, what kind of skills they have and organizations for mobilizing people to influence the decision making. Right? How many of you have a lot of money? And you probably think that Harvard professors have a lot of money too, but we don't have much money compared to what we have to do, right? How many of you are good at mobilizing votes? You go out there and you knock on doors and get people to come out and vote? Not much, probably, right? You may have some skills in bargaining and negotiating, especially within your organization, right? And you work for an organization that may have some power. But most of our power comes from our expertise, the information that we have about the health sector, the credibility that is given to us because we are experts in this area, right? And although I don't have a lot of money, votes, or power, often because I come from Harvard, people will listen to what I have to say. So think about and understand that you are also a political actor. and that you have some power in influencing what happens because of your expertise, because of the information you have, because you are credible, you're credibly able to say, I think I have thought through some of the problems that might occur, and I'm giving you a good idea about what would work. And then you may have access to other decision makers, and that helps strengthen your role. And sometimes someone that is passionately committed to some kind of health reform mobilizes other people just by their enthusiasm and excitement about what they're doing. I was working in Colombia where they had a major health reform. The Minister of Health was so dedicated to the vision he had that lots of other people in the parliament and others just gravitated to his interest, even though he didn't have much money, he didn't have much votes, he was not very powerful in that sense, but because he was so committed and because he had that information, he was able to pass his health reform. So estimating power is difficult, but don't underestimate your own power in this kind of game. Right? So then what you want to do is to think about the strategies that will increase support, and that means increase the number of stakeholders, and also will increase their power, right? And you want to try to do things that reduce the number of opponents and maybe reduce their power as well, right? So let's think about that. This is what happened in our exercise with Michael's policymaker software. This was the original chart that you saw. We developed a series of strategies to try to improve that distribution. And what we did was we mobilized some of the non-mobilized group, and they came into the supporters. But you could see that we moved some of the opponents to the middle group or even to the supporters. Right? So the software is good because it then can help you try to figure out what you've done, right? After you've thought through the strategies and what it would do to change each of the stakeholders. Now, if you looked at that, what would you do next? If this was the Clinton plan, he probably should have said, I better give up. Right? Because he still has more opponents than he has supporters. But the better solution is go back and try to find better strategies that will shift the balance to having more support and less opposition. Right? So, here are some of the general ways of thinking about increasing the support. Increase the legitimacy of the supporters. Make sure if your benefits are going to address the more vulnerable population, try to get them to be part of your supporters and try to make sure that people see them as legitimate participants in the game. Right? Increase your access to the actual decision makers. If they're going to be in Parliament, go talk to them and try to find out how you can persuade them to support you. Increase public visibility with the media and others. Give more information that we have and about what would work and what wouldn't work, maybe using some international examples. Help them raise money. All right? Those are some general things. And you could do things to undermine your opponents, right? Decrease their legitimacy, reduce their access, reduce their visibility in the media. And some things that we found are particularly effective is splitting off some of the key groups. If the physicians and the nurses are opposed to some strategy that you have, you may want to compromise with the nurses and do something that will encourage them to be more supportive and to break them away from seeing themselves as a uniform group of people, of providers that's opposed to what you want to do. may negotiate and compromise with different groups. Or you can question their motives. And I'll talk about that in a minute in the general strategy. Right? So here are some of the general, broader strategies that we could think about. And as you could see from my discussion of bargaining and negotiating, probably the best strategy you should think about is how can I compromise from what we talked about as the value maximizing or the rational actor best way to make decisions to making the best compromise, right? And that's probably a good place to start. But something that is also effective is mudslinging. Something, do you know, I don't know how you translate that, right? Or negative campaigning, right? That's questioning the motives of the opponents, right? The physicians are opposed to what we want to do because they think it's going to threaten their income. Therefore, they're only interested in themselves and not in improving the health of the whole population. Right? In the United States, we talk about mudslinging largely in terms of negative campaigning. And when we interview the voters, they all say, we don't like negative campaigning, it's bad, and we don't respond. But when we do the analysis of the actual voting behavior, negative campaigning always works. It helps undermine the legitimacy of the stakeholders that you're attacking, right? It, however, is a dangerous thing for most of us to try to do. Because if our power depends on expertise, information, credibility, if we get into a negative campaign and it looks like we're behaving like regular politicians, then it may undermine our own power, and it's not usually a good idea. The other reason not to use negative campaigning or mudslinging is we have an expression in English, I would bet you do too. People in glass houses should not throw stones. Right? People in glass houses should not throw stones. Right? If you start negative campaigning against the people that oppose you, guess what they're going to do? Right? They're going to attack you. Right? And they're going to attack you. They're going to say, oh, you're just listening to the world bankers. Right? And they're not interested in Armenia. They have their own set of interests. Right? Why? And so they will attack you, and you're in a glass house. Right? You have... It's not easy for you, or it's easy for them to attack you. Right? So those are two reasons, but in the end, it is something to think about as a potential strategy for some situations. Now, another strategy is something we call trades. It's different than compromise. It's offering your support to other stakeholders for things that they want in return for them supporting you. For instance, the Minister of Health goes into the cabinet meeting and talks to the Minister of Education and says, if you will support my health reform, I will support your university reform. That's not compromising. He's not changing the package of what he wants to do. He's saying, I will support you if you will support me. An awful lot of politics happens that way, right? Where different stakeholders will work together without compromising the things that they want to do and using their own power and support to help each other. Right? Then another strategy that we found quite interesting and often ignored is to change the perceptions of what you want to do. My best example of this is in the United States. We used to promote something that was called population control. Right? That was giving condoms and pills to control the populations of mainly less developed countries in the world. Right? That created a tremendous negative reaction. Right? Why does the United States want to control our population? Right? And then what USAID and others did, they said, oh, wait a minute now, we don't want to control your population. We want to help you plan your families. Right? We're not in the control business. The pills and the condoms are still the same, but we want to help you plan your family. And then as feminism became more of a powerful political process, we said, well, it's not just family planning we want to do reproductive health. And so the condoms and pills now are for this. This is an example of how you can change people's perceptions of what you're trying to do by changing the name of what you're doing. The name of this course used to be the flagship course on health sector reform and financial change. Right? It is now the flagship course on health system strengthening. We're not trying to reform your system, we're trying to strengthen it. We're still using the same concepts and the same things involved, right? I'm sorry, I didn't mean to cut you off. Let's see if we have one.
Thanks. So, but what do you think? What was the real goal? Like, why do United States should care about family planning or population control in other countries? So, what was the real insight in this project?
Well, what do you think?
I don't know.
I mean, I think it's because it changed the concepts. People who are pushing for family planning and for reproductive health don't think of themselves as trying to control populations, right? So having changed the terms.
The branding part, I understand. I mean,
yeah.
What's really was happening? Why should United States care about planning population in third country? Is it migration issues? What kind of issues they try to?
It's probably a combination, and if you did a careful stakeholder analysis, you would find that there are different stakeholders that have different sets of objectives. Some of them are, interest in. Some of us work in international areas where our interests are to help people make better choices about their lives. Others are more cynical about that and would say, well, the United States still needs to help control populations because that is going to contribute to global warming, to other things that will affect the United States. And the actors are different in that. And again, you may not be able to find a uniform set of objectives. If you look at the goals, we may all agree on them, but they may still be driven by different interests. Right? Okay, other questions? Okay, another strategy that you can use is creating information packets designed to focus and empathize with the stakeholders' own interests. Right? So you would explain to them what it is that is good for them about the program that you're proposing. Right? If we had known that Medicare and Medicaid was going to increase the salaries of physicians, we would have tried to use a packet to say, you shouldn't be opposed to this because this is going to be in your interest. Right? And I've done this in several countries where we try to create packets that explain to people, and it means you have to be empathetic. You have to say, not, I need to persuade these people to agree with me and understand why I'm in favor of this, but try to understand what it is that you're trying to propose that will be to their advantage. Right? And then deny information to those who are opposed to you. And one experiment that we found that was particularly good was a change team, creating a change team. And this, we did some research on reforms in Latin America, and we found that the countries that you had what they called the change team were more effective than other countries. It's a core group of technocrats who are also related to politics in that they know people or are protected by people who are high political power, have high political power. And important for this, and I've seen this happen in many countries, the reform should not be only in the Ministry of Health. Right? It meant that people in the change team were in other ministries, and if there weren't people that that shared the values of these technocrats, they would, and they explicitly said that, they would colonize the other institutions. They would put people in that agreed with them so that they could try to persuade the other organizations to support us, or they would find out more about what kind of opposition would happen in that other organization, right? And that turned out to be quite useful. Instead of the ministry saying, we're the ones that need to and should make all the decisions, having someone in the president's office, having someone in the finance ministry, and in the other major stakeholders, these are ways to make decisions. Yeah. Oops. Let's see. Where?
No. Yeah.
Yeah. Now.
Do you see trust and integrity as a power for?
What do you mean, trust and?
The trust that the political person or Ministry of Health has, and the integrity that helps to go through this process or not.
Sure, that would be helpful, right? Not necessarily always works, right? Well, lots of people supported or trusted Obama, but a lot of other people didn't trust him at all, right? And so trust is something that you can use. It may be something I should put in the list of things that give you more power, but yes, yeah. Okay. More recently, another strategy is social media. And Donald Trump has been particularly good at mobilizing support through social media and through making claims about fake news and that sort of stuff, right? So social media may be another way, especially if your other stakeholders are paying attention to what the broader population wants and knows. Right? So social media is another strategy that you can use to mobilize players in favor of what you want to do. Okay, I'm running out of time here, so what I'd like to do, here is the way you can download the policymaker. It's called www.polymap.com. Right? And what I'd like to do is have you do an exercise. Right? There are two possible objectives. Right? One is obtain national funding to replace donor funding for TB, HIV/AIDS, and immunization. Right? The other would be remove chemotherapy and hemodialysis from the basic package. Right? And make a list using the boards of who are the major stakeholders, and for each of them, what is their position? And since we don't have the software, what you do is for high power, put in 4 pluses, and for high opposition, 4 minuses, and the undecided 0. Right? And for power, similar. High power is 3 pluses, and low power is only 1 plus. Okay? So maybe this table, and maybe they could join one of these tables. And these 4 tables, this group does the national funding for donors. This group does the taking out of a benefits package, something that some groups are going to oppose. Okay? Does that make sense? And we'll try to do that in 15 minutes and then go around quickly for a review. Okay? Can we have some help bringing the flip charts to the tables? Is that clear? Does anybody have any questions about what you should be doing?